There's some good information on 25 about effective dose, lethal dose, toxic dose, and therapeutic index. What obviously effective dose is what dose is necessary for the drug to be effective in 50% of people. Toxic dose or lethal dose is what percent or how much of the drug is needed to kill 50% of people. What I'm more interested in, and I think you will be too for your practice, is therapeutic index, or sometimes we talk about therapeutic window. Those are the drugs that we have to be careful with that will require frequent blood monitoring in your clinics during hospital stays. And the therapeutic window describes the range between which a drug helps and hurts. So this drug, digoxin, for example, has a narrow therapeutic window. This much digoxin is way too much. It'll stop your heart. This much digoxin is not enough, and it won't control your heart rate. So somewhere in here is where it works just right. Like Goldilocks and the Three Bears. Now, if you don't find this class interesting, that's your fault. Also, if you hear splashing noises, it sounds like someone's using the bathroom. That's my aquarium. I don't know why I said that, but it just occurred to me that that's what it sounded like. Therapeutic index is described on page 26. There's a formula for it. I'm not going to ask you for a formula. Simply know what that means. On page 27, understanding pharmacokinetics. That's how the body affects drugs. So we take a drug to affect the body, but equally the body affects drugs. We hear about metabolism. I know everybody remembers from undergraduate pharmacology the cytochrome P450 pathways in the liver. Very important stuff. So on page 27, table 2.2 has 5 definitions on there. Pay close attention to those. Those are very important definitions for how the body affects a drug, and then those are expounded upon on the following pages. Just know that on the next several pages, any of that information could be gained for the quiz. It really talks about absorption, distribution, bioavailability, metabolism, excretion, half-life, that kind of stuff. Things that are important for you to know. Distribution throughout the body is going to be an important thing to pay attention to. And absorption, where do drugs mostly absorb? Where are most drugs excreted? Now remember, when I say most, I mean in general. There are always those drugs that are never excreted in the same manner as others, or absorbed, or whatever. So read through that. Bioavailability kind of touches on that. How much of the drug survives the absorption process to make it systemically, get where it needs to go and do what it needs to do. There it is on page 31, cytochrome P450. Here's what I want you to know about cytochrome P450. It describes a million different cytochrome P something. They're all different metabolism pathways in the liver. Many drugs, many things, foods, whatever, chemical compounds the body digests something into are processed through many of these, some at the same time. And what's important is to understand medications that are processed by the similar cytochrome P450 pathways may be in competition. You may prescribe one that cancels out the other. Or there may be those that actually cause a synergistic effect and make one or the other or both medications work more than we want them to. I don't care that you know all of the cytochrome P450s because I would fail that exam myself. What is important is understanding of how drugs are metabolized and why some of these drugs may be important. Now, when prescribing medicine is on a daily basis, are you going to say, this is metabolized through the cytochrome 3A4, so I better not prescribe that? No, you're not going to do that. I can't actually think of an instance where I've considered that when making a prescription, but it's very important science that we understand it, and for that purpose, there are some examples in that reading. I'm particularly looking at page 31, bottom right-hand paragraph may have some examples that might be beneficial to you in the future. On page 32, talks about excretion. Most medications are excreted through the kidneys. Renal function is very important to a lot of medications. Remember, if your kidneys are injured, you're dehydrated, acute renal insufficiency, if a medication cannot be excreted, then it will stay in the body. Most classic example is Coumadin. Who's not on it? Every 80-something-year-old lady or man who comes into your clinic with a black leg in the middle of the summertime, and they don't know how it got that way, check their INR and check their creatinine and BUN. I guarantee they'll be high just alike. People get dehydrated, especially the elderly people. They don't drink enough water for all kinds of reasons. They don't like it, or they say, I drink water all the time, but it's not nearly enough. It's one of those little half bottles of water once a day, or maybe once in the morning, once in the evening, and for them that is a lot. Their skin is thin, water is evaporating, they're talking, urinating. A lot of them are probably on some kind of a diuretic too. Anyways, moral of the story is the fact that they're dehydrated, their renal function might show an elevated creatinine, which indicates they're not filtering like they should. Well, that explains why your Coumadin is high with an INR of 6 and their leg is black. Just consider that. Remember. Okay, page 33, half-life. That kind of goes back to one of the questions on that 6 amazing questions table. How long is the drug going to stay around in the body? That will be important when considering a few things like interactions with other medications. Something that I'm particularly more concerned about, and you will be too, even in family practice, because you'll be coordinating with outpatient surgeries and things like that, clearing patients for surgery. There may be medications that they're on, Coumadin, for example, that requires you to be off at least 5 to 7 days prior to surgery because it's in your body that long and you don't want the patient to bleed out. Again, I've referenced amiodarone. Don't worry about the specific drugs right now for this section. This simply is an understanding of what a half-life is. And a half-life is, by definition, from the book, a measure of how long it takes for half of a drug to be eliminated from the bloodstream. There is a fine example in the middle of that page on the left-hand side. It has 6 days worth of half-lives and gives you a very good display of what a half-life is. There may be a question to the tune of, I've prescribed, or you have prescribed, X amount of milligrams of medication A. It has a half-life of 1 hour. The patient takes it at 9 o'clock in the morning. What's the half-life at 12 o'clock in the afternoon? That may also be found in some of the questions on page 34. Okay, that concludes the video content. I did not cover everything in the reading. I do want you to read. I know you've got a lot going on. The first quiz will be opened up over the weekend. It will last for 3 or 4 days. It will not be a very large quiz at all. There will be questions from Chapter 1, Chapter 2, and the syllabus. Pay attention. Syllabus questions will not be that hard, trust me. Probably more like, did you read the syllabus or not? If you get that wrong, you deserve to get it wrong. Okay, again, if you have any questions, concerns, anything at all that you're worried about, please call me. This course needs to be as stress-free as possible because it's a lot of information. You're not going to fail this class unless you just don't do anything. If you sit at home watching Real Housewives of wherever, you may not pass it. Otherwise, this is going to be good stuff. We'll get you through it. Let's get this first test over. Then we're going to jump into the deep end with some of the tougher stuff. Call, text, email. I'll see y'all next week.